Thank you. And thanks everybody for joining us early this morning. We're having our program a little earlier than normal, but to accommodate everyone's schedule. So I'm glad you could join us. We'd like to start off usually by introducing our board. I'm Jerry Burton. I'm the president of Nevada Now. Our executive vice president is Tricia Methner. Wave, Tricia. You've met Eva. She's our vice president outreach. And Madalena Robertson is our Vice President Media. She helps with the website and makes our graphics and pretty much does whatever I need her to do. She's wonderful. We have a Vice President, let's see, Sue, you wear so many hats. Legislative Action. She's also our Nevada Now PAC Treasurer and Chair of the Legislative Committee. So that's our wonderful Sue. And Lenore Briley is our Nevada Now Treasurer, longtime treasurer, never allowed to leave. And our newest member, Michelle Maese, is our secretary. She is also helping plan all of our programs. So I thank her so much for putting this one together. And we have some other great programs coming up. So hold the date. The next thing we're doing, April 20th, Cy Burnaby is going to do something that Sue and I have been trying to put together for a while with Cy and work out the schedule. We're going to do a how to be an amazing trans ally training, terminology, pronouns. We all could use a brush up on that or a regular program. That'll be April 20th at 5 p.m. And we're having that during the week because the next meeting will be April 25th at 4 on that Sunday at our typical time. And we're going to cover equality with LGBTQ issues, also child sex trafficking, and it's kind of be a jam-packed program of with Andre Wade, with Silver State Equality. Cy will join us from Gender Justice after doing the training the week before, during the week. We're hoping Senator Scheible can come back and talk about some of her bills on this issue that's so important to her. And we have Christina Bella from St. Jude's Ranch that we've worked with before on child sex trafficking. And our Nevada Now did our last in-person Christmas party. We did a fundraiser for their new facility there. So we want to hear how that's going. So that'll be a busy program. And we hope you'll join us on the 20th for our training to be good allies. And then on May 10th, our last time we had a meeting on the topic today on domestic violence against women, was on Mother's Day last year, right during the beginning of the pandemic. This year on Mother's Day, it happens that it falls again. We're going to do one on helping Nevada's children and children in foster care. It's a very important issue to our Secretary, Michelle Maese, and she's invited some people from CASA, people to talk about foster parent recruitment and training, and Senator Harris and Assemblywoman Hansen will join us to talk about bills there. So we've got a lot coming up. We'll put it out on the calendar. You don't have to memorize it, but you can hold the dates. So, and just another quick update, our Nevada Now chapter has been very involved with the Equal Rights Amendment. We're going to put out a graphic that we've been using to send to our senators to ask them to support SJ Res 1, the House bill passed to remove the deadline, and Nevada State ERA has passed and going to, and I always have to get out my prop. In both cases, they were wearing our ERAS masks that Nevada Now and the 28th Amendment Committee have been working on, and they were wearing them to vote on the ERA in our Nevada State Senate, and also on the House for the federal, they were wearing our masks when they walked in to vote on removing the deadline. So that was exciting, and they were really tied to this issue. So we'll be putting out more information on how you can be an ERA activist and continue the work that Nevada did when we ratified in 2017. We feel a responsibility to help get it over the finish line. So it's something that we're really involved in with our chapter. So. And Sue's going to talk about the legislative update. We're really excited. One of our favorite bills this year is AB 224 to provide period products in schools that Samantha Glover, the wonderful 16-year-old student, has brought to to try to get passed, and we've kind of adopted her. So we're so excited to see it pass out of the Education Committee and the Assembly side, and needs to hit the floor now and get a vote. But it's so exciting to watch her presentation. If you haven't seen it yet, you need to do it. So Sue, do you want to just give a quick update on what Nevada Now is supporting and what we're working on?
Sure, considering you just took a big piece of my update.
You can celebrate too.
Yeah, no worries. Hey, we have 50 days left of the legislative session, and right now I just want to take a minute to thank everyone for their efforts. I think we've been out there, and I think our presence has been felt. But I especially want to thank Jerry, who has testified several times on behalf of Nevada Now, and she has done it effortlessly, effectively, and professionally. So thank you, Jerry. We're so proud of you. Friday was the deadline for bills to get voted out of committee, and as Jerry said, we're very proud of our friend Samantha Glover. You all met her, I think, last week. We have adopted her. We're all proud parents. Her period equity bill has made it out of committee. It will, with unanimous support out of the Education Committee. It was amended, though, to be a pilot program, but it's still an amazing accomplishment from an amazing young woman, and I'm truly looking forward to the future of Samantha Glover, and whatever we can do to move her forward would be great. A lot of great bills have gone through committee, like the AB 286, the ban on ghost guns. The 3 mining bills have an exemption. And there's just a lot of good things happening. So I appreciate everybody's efforts. We will continue to have our Tuesday meetings at 5 o'clock. I'm going to put the link in the chat, and I'll also send it out. The only exception is going to be, like Jerry mentioned, Tuesday, when we have Sci for ally training that I'm very excited about. So thank you, everyone, once again, and let's keep up the good work.
And thank you, Sue. I know that's like a love fest here, but this is something that I did last session, and it took a lot of time, and I realized I needed help. And so, one should learn from this, because I asked for help, and I've got Sue taking over the legislative committee. Michelle's helping planning programs. I've just gotten so much wonderful help from our board. So anyway, love to all of you. So. And we reached out to Senator Scheible. She has a couple great bills that tie into some of the things we're going to be talking about today, and that some of the organizations are supporting. And we just wanted to see if she could give us an update on some of those bills that she's working on. Senator?
Hello, thank you. And I would love to give you an update. And I also want to join Love Fest, because I love Nevada Now, and you guys are I'm not supposed to say this, but you're one of my favorite organizations, and you do have a fantastic board.
You can say it.
Okay. And it's been great to see you guys, or hear you guys testifying in committee and getting involved in a lot of different bills. And, one of the things that I love about Nevada Now and the Nevada legislature is that, we have bills and we have issues that affect primarily women, or affect women in special ways, but we don't really have women's issues, right? Because every issue is a woman's issue. And Nevada Now is always there with us, figuring out how to be supportive, how to be more inclusive, how to be more effective. And so I will move now to describing some of the bills, or giving an update on some of the bills that we've been hearing and we've been talking about. And before this meeting, I was kind of writing down a couple of them and thinking through them, and there are so many this session. Definitely Samantha Glover's period equity bill, I love. I think that now she and I we both got to say tampon on the record in the Nevada State Legislature, so I think that's like, a really cool accomplishment. And that's what happens when you have women in the majority, is that people no longer cower in fear at the word tampon. And I used that word when I was talking about a bill that has past deadline day, it requires the Nevada Department of Corrections to implement policies for transgender people who are currently incarcerated, because right now the Department of Corrections doesn't have a policy that's specific to transgender or intersex or gender diverse people in their custody. They're just supposed to follow the policies that they use for everybody else, which doesn't quite work when you're talking about somebody who needs hormone replacement therapy, or, and this is where it came up, something more simple, like maybe there is somebody in the men's prison who is a man who still menstruates and needs a tampon. And it costs almost no money and almost no time just to ensure that that one person who is in custody has access to the products that they need at the commissary. But because the policy says that it doesn't specify, it just says that, the women's prisons will have this and the men's prisons will have that and everybody will have access. It's not specific enough. So I'm very proud of that bill. That is SB 258. It made it through the Judiciary Committee and that will be headed to the floor soon. On the topic of equality for people who are gender diverse, I also passed a bill through the Commerce and Labor Committee so far, SB 139, which requires insurance companies to cover medically necessary treatment for people experiencing gender dysphoria. So that includes, everything from a hormone replacement therapy, gender affirmation surgery. It could even be something like what would in other contexts be considered cosmetic surgery, like the tracheal shave, removing what we call an Adam's apple for trans women and other people. So that bill has made it through the deadline day. And we also have, so now that we're on commerce and labor, I'll go through a couple of the other commerce and labor bills that I'm super proud of and very happy that I could support. Nicole Cannizzaro passed another bill this session on pay equity, and the bill prohibits employers from utilizing pay history in setting their new pay scales or in determining what they're going to pay somebody, which I think is a really important bill. And what's important to know about it is that this is not just an idea that she came up with, but that scientific studies have actually shown that places where they have the salary history bands actually do pay women more than areas that don't. So it doesn't prohibit somebody from, utilizing their salary history in negotiations if it's something that's important to them, but it does prohibit an employer from finding out what you were making at your previous job and then lowering their offer because they know that you have already been subjected to the pay gap. So that bill is really important. I don't remember the number, but I can look it up for you. We also passed a bill to include LGBTQ identified businesses as minority-owned businesses and ensure that we are providing them with the same kinds of services that we provide for women-owned and minority-owned businesses. I also am working on a bill, SB 364, which made it through the Health and Human Services Committee that will allow, or actually it will require hospitals to provide emergency contraceptives to survivors of sexual assault. The good news is this is something Nevada hospitals are doing. It's not a response to a major crisis. It's simply a best practices bill. And one of the interesting things that happens in the legislature and in this whole policymaking process is that we work with real people, individuals who go through experiences, and sometimes we can't always get to the bottom of what it is. And so this is a perfect example of a bill where women in Nevada have, kind of said that they went to the emergency room and were provided with emergency contraceptives, but we're not sure what emergency rooms they went to. We're not sure when this occurred, but it was just kind of something that activists and policymakers have been hearing. And so that's why I decided to carry the bill, was that it really doesn't burden anybody to ensure that you get emergency contraceptive when you're at the hospital. Everybody is supposed to. And it was actually very heartening to have all of the hospitals reach out to me and say, oh my gosh, was this one of our facilities? Was it one of our providers? And I got to tell them, no, it's not, we're not picking on anybody. There's no one who is, abusing this right now. We just want to make sure that it's in law so that if anybody ever does encounter this problem, they know that the law is behind them, that they are entitled to an emergency contraceptive when they go to the emergency room reporting a sexual assault. I also am working on another bill, SB 164. That bill addresses human trafficking and sex work, and I recently turned it into a study. I worked very long and very hard with Metro to try to come up with a strategy for passing a bill that would allow them to stop arresting victims of sex trafficking. And we decided that we had to do a study on it and spend the interim learning a little bit more about the problem, learning a little bit more about possible solutions, learning a little bit more about where our stakeholders are, and get some more community input. So I think that is going to be a really exciting project over the interim. I also worked with the Nevada Coalition to End Domestic and Sexual Violence to pass a bill through the Education Committee that would establish a new task force in NSHE, or in Nevada Systems of Higher Education and in higher education institutions, to do a climate survey on sexual violence on college campuses and provide people who experience sexual violence on college campuses with resources, an advocate, and a path to receive services whether or not they choose to report the incident to law enforcement. I feel like I've been going on for a while now. There are so many bills.
The other night I had on my list, Senator, was SB 177, the marriage license.
Oh my gosh, you went? Yes.
I knew you were on that one.
Yes, and that is one of my favorite bills. And Senator Ratty's bill, and for those of you who don't know, it proposes a $25 increase in the marriage license fee in order to fund organizations that combat sexual and domestic violence. And the reason that this is really important is that it was 40 years ago that the state first realized that sexual and domestic violence are a problem, and we need to start funding organizations that combat them. And so 40 years ago in, in the 1983 session, I think it was, or maybe 85 session, they passed a bill. Oops, am I still there?
Yes.
Okay. They passed a bill that would utilize a fee from the marriage licenses to go into a special account that is then distributed to those organizations. And it is the only funding source in the state of Nevada for, only government funding source for combating sexual and domestic violence. Over the last 40 years, numerous legislators have tried numerous times to either get a general fund appropriation or get another fee on another service to increase funding through other mechanisms, and nothing has worked. And so this year, Senator Ratty has suggested that we just increase the marriage license fee, add on another $25 to produce over $1 million in revenue. And a lot of Republicans didn't like this suggestion, and they tried to bring some other suggestions to the table, which were also not viable. I went through the ringer with Senator Ratty looking at divorce fees, looking at court fees, looking at other places that we could increase this fee, and they just don't exist, and they just don't produce the same kind of revenue. So I think that paying a $25 additional fee on a marriage license is not going to put chapels out of business. It's not going to put, not going to stop people from getting married. And I also I did not say this in committee, but I'll say it to you guys because I think this is kind of funny. I am the only member of the Judiciary Committee who is not married. And so I think I'm actually the only person who this would affect, because if I ever do get married, unless one of them gets divorced and remarried, then I'll be paying that additional fee, and I have no problem doing that. So I think that's a really important bill that you're going to see pass through the Senate soon, and then go over to the Assembly side. And I think I saw a question, how much is the current fee? It varies by county. So there's a state fee and a county fee, and then there are sometimes local fees as well, like municipal fees. I believe the average marriage license in Nevada is around $100. which is actually a little bit more expensive than some other states, but we've been at that rate for 40 years.
Melanie, I can answer that. It's Liz from Safe Nest. So
Thank you.
The Clark County fee is currently $77 for a marriage license, and in Washoe it's $61. And in 2017, the legislature added $14 to marriage license for Clark County to do marriage license tourism marketing, and there was zero effect on the number of licenses. People are not comparative shopping their marriage license, as we can probably guess, right? And most people surveyed don't have any clue what their marriage license fee was. It's part of the package coming from the chapel. So the argument that it would decrease chapels' marriages is been proven to be fairly innocuous at this point.
I think people come here to get married and they probably have no idea what the fee is. They just pay whatever it is. But I do know that when my husband heard it, he said, well, it's 77 because lucky number 7 for Vegas, right? So they're going to have to put a 7 on the end of it somehow.
That's fine.
117 or something like that.
Right. Great.
Thank you so much. I've been making notes, and I know Sue was too, because we've been trying to keep track of all the bills that are important, and I appreciate you taking the time to talk to us today. We'll be following those, and let us know. I had Senator Spearman call me at 8 in the morning the other day to say, get on and testify for the CDAW bill. So you can do the same with us. We'll hop on and help out. So
CDAW is another great bill. And I mean, we already talked about SJR 10, but yeah, we heard CDAW just this week, and that one is a pretty incredible bill.
Yeah, and then the ERA, and we've just had so many wonderful. It's too bad we couldn't be in person and meeting afterwards to celebrate, but soon.
Soon, yes.
Thank you so much for joining us. I appreciate the update. Like I say, we were taking notes, so we'll be following those bills.
All right. Well, I'm going to sign off then, and I encourage all of you, if anybody on this call, I'm not sure how many there are, but if anybody doesn't have my contact information, I encourage you to reach out to Jerry. Please feel free to share it with anybody who wants to follow up on any of these bills. And I'm always happy to set up a video call like this, or, send some emails back and forth and make sure that we get the good work done.
Thanks. We have a lot of activists listening in. I'm sure they will.
Good.
Thanks so much.
All right. Thank you.
So we'll start our program that we planned. We're trying to fit a lot in, I know. We all know April is Sexual Assault Awareness Month, and we've invited some wonderful organizations that work in our community to hear, as we talked about before, the last time we had a program. We've had programs throughout the pandemic, and we've talked about how it's affecting women, and so we've certainly talked about it, but to specifically have a program on violence against women or domestic violence was last Mother's Day. And at the beginning, I know we had a couple of the different organizations that are on today. They didn't quite know we didn't know obviously how long this was going to last or how they were going to provide services, and they were having to shut down for safety reasons, for health, and we know how much this has affected our economy, and so we know things have radically changed since then, and we wanted to have you back and have organizations talk about how it's affected them and how some are opening back up again and providing services. One of the things that NOW has worked on nationally is the Violence Against Women's Act, and we know that's being held up in the Senate. It's been passed in the House. It was passed at the same time, the same day as the ERA that we've been working on. So, and we know that provides a lot of money for all the organizations in town. We're asking, President Biden he was at the very beginning as a senator getting the Violence Against Women's Act implemented. He's certainly working on getting it passed. I know we were talking about statistics earlier, but when he was talking about it passing in the House, he said as many as 1 in 3 women are subjected to domestic violence, dating violence, sexual assault, and stalking at some point in their lives, and the rate is even higher for women of color, Native American women, members of the LGBTQ community. Growing evidence shows that COVID-19 has only exacerbated the threat of intimate partner violence, creating a pandemic within a pandemic for countless of women at risk for abuse. In short, it's an urgent crisis. And Majority Leader Pelosi, talking about the bill, said the act said that it strengthens, it expands essential protections for the most vulnerable, including immigrant, LGBTQ, and Native American women. And one of the things I know you all know because you work in this area, but it adds the protection for Native American women, but also there's some gun piece of regulating guns with domestic violence in there, and we're hopeful that it'll get passed and help. So I'm getting my...
If I said something about VAWA real quick,
yes.
I think it's timely. So I need folks, and this is what we've been working with Cortez Masto and Rosen's office on. Activists like ourselves need to understand VAWA, when it was established in the 90s, 40% of the funding was coming to agencies like Safe Nest, Safe House, and the like. Today, we get 13% of VAWA funding. 87% is going to the justice system. So when we hear slogans and campaigns like defund police, what we're actually asking for is a reallocation of that funding back out to support the victims at the victim level. And so that's a really important part of VAWA for folks to understand. Safe Nest is a $7 million annual agency. We are the largest agency in the state. We get $20,000 a year from VAWA. So it's a great bill, and I shared the same information with Biden when he came through on campaign. It's
Right.
time, though, for the nonprofits to stand up and say, this needs to be allocated in a way that it actually is helping victims and not supporting the court system, which, by the way, is not always the avenue. In fact, most of the time, not the avenue that's right for victims anyway. So I just wanted to get that plug in there.
Thank you. And that's something we need to research on the national level with NOW, because they're very involved with this. And I didn't know that. Thank you so much. That's good information to have. So that's why we're here today, to learn. So we thought we're kind of going in order of when we made our graphics. So Safe House was the first one on there. Michelle, do you want to introduce the speakers for Safe House? I know you've helped me set this up. So.
Thank you. I would love to.
Thank you.
Yes, you're welcome. So I work for the Department of Family Services, and there's a couple other ladies on here as well who also work for the Department of Family Services, and then I'm on the board of NOW. And we have worked with Safe House for a number of years. I've been with the county for 15 years. And this organization is wonderful for women who need an emergency placement right now. We have had calls in the middle of the night, taken parents, taken children, and I am really honored to introduce Carolyn Mascari, who is retired from Safe House, as well as Beth, who are going to share about Safe House and the program and how it helps women and children, and then services after. And then we'd just like to know about what happened during the pandemic and what's happening now. So I think Beth wanted to go first.
Yeah, absolutely. First of all, I want to thank Nevada Now for hosting this panel addressing the impacts of COVID-19 on our local domestic violence agencies. And I'd like to thank Senator Melanie Scheible for co-sponsoring Senate Bill 177 and serving on the Senate Judiciary Committee and passing this important bill out on Thursday. We love what she's doing, helping victims of domestic violence, sexual assault, and LGBTQ communities. So amazing work there. All right, so Safe House is located in Henderson. It actually began in 1994. It was conceived by Julie Proctor's vision because she herself was a victim of domestic violence. Her husband and 8 other volunteers ended up starting the agency. Since then, we've had the mission to stop abuse in the family environment, which is our acronym of our name. And we've become a very comprehensive domestic violence organization in the state. Since its inception, the agency has provided emergency shelter, counseling, advocacy, housing assistance, and education to more than 85,000 people from very diverse backgrounds. And all of those services are free of charge. So we do not charge anybody for the services that we provide. Now, I started my employment with Safe House in March of 2009. So I've actually been with Safe House for quite a long time. I started working in the emergency shelter, assisting survivors and answering the hotline. I then did children's advocacy for several years and then became a leader in the organization because of my education and supervisory experience. And so now I'm the director of operations, and Julie Proctor is actually our current executive director. So I help her with many operational, financial, human resource type functions. So when the news of the pandemic began to spread in March of last year, we knew we would have to make drastic changes in our operations. And so on the eve of my 11-year anniversary, which is March 30th, so it literally was on the eve, I found myself at the forefront of determining the future path of my organization and therefore the availability of services to victims of intimate partner violence. And it was of utmost importance to us that crucial services to victims not be interrupted, because as my fellow members of this meeting can attest that have joined us, we're in the business of saving lives, so we just can't close. We also could foresee the potential of that proverbial perfect storm that this situation could create for victims, such as being stuck inside your home for 24 hours a day with an abusive partner, accessibility to services, financial hardship, the stress of children staying home from school. All of those things could compound. The other part of this is victims of trauma can experience many long-term side effects, such as symptoms of depression, nightmares, sleep disturbances, susceptibility to substance use, and feelings of disconnection. COVID-19 is by nature a traumatic experience, which we all now are forced to process and endure as a global collective. So for a victim, it's like a tornado forming in already turbulent weather. We quickly moved our victim advocates, counselors, and outreach staff to staggered telework schedules and adapted to utilizing virtual platforms. We instituted numerous safety protocols at our office and shelter, which included changes in cleaning, meal distribution. We actually hired a cook, donation processing, and of course, physical distancing. We dedicated shelter bedrooms to quarantine, like a quarantine room in case a resident tested positive for COVID-19, so they would be able to stay in the location. But that also meant that we had to cut our shelter capacity in half between all of those protocols. And of course, reduced bed space means less victims can enter our shelter. And though we can't pay for motel lodging, which we have done, it really is not an optimal environment for safety, for that extra support and that healing you get when you are with employees as well as other victims in the healing process. In addition to these challenges, we also had to ensure that the mental health and the well-being of our employees was supported so they could remain strong and mindfully present for our clientele, while at the same time managing the impacts of the pandemic in their very own lives. Our staff and clients have shared many moving stories with me over the last year. One control tactic we know abusive partners use is isolation. So one of our survivors told our counselor that she was the only person she had talked to for months and was her lifeline during this stressful time. Another said she thought COVID-19 meant there was literally no hope for escaping, and finding out that the shelter was still open changed her and her children's lives. Our virtual support group attendees have said the social interaction has been invaluable to their mental well-being. And I did have a male victim come in who I was helping him pick out food from our free food pantry. And he was crying because he said that he had been stealing from the grocery store and was scared that what would happen to his children if he had got caught stealing food. So despite the difficulty of this situation, we've succeeded because of the selfless dedication of our employees, volunteers, and community members such as yourselves. From dropping off toilet paper and homemade masks within days of when this started to monetary donations, Vegas Valley has stepped up to the plate. Luckily, we entered this pandemic fiscally strong so we could handle this type of disruption. However, our bank account is not an endless well of money. COVID-19 meant that we had to cancel our fall 5K run and our spring brunch and silent auction, which are two fundraising events that generate considerable funds and exposure for Safe House. We also held deep concern for our sister agencies in rural Nevada, who may not have the inherent support afforded by living in a larger metropolitan area that we have. So for those tuning into this discussion, there are numerous ways that you can help. Definitely monetary and tangible donations help us, and also volunteerism. We do have a volunteer program. These are vital to the success of our agencies. And though we receive state and federal funding as well as foundation grants, it does not cover all of the costs of running a successful nonprofit, especially in a time like this. And I do want to kind of finish this by talking a little bit about Senate Bill 177 that Senator Scheible brought up. Another way you can help us is by supporting that bill, and doing so by contacting your state senators. The bill was voted out of the Senate Judiciary Committee on Thursday on party lines, so that meant that all Democrats voted yay and all Republicans voted nay. So now to pass the Senate, 2 Republicans will need to vote yes. And we need all of our senators to hear from you before April 20th. So please tell them that domestic violence and sexual assault affects victims from every political affiliation, and this crucial bill needs to be passed. In Senate Bill 177 and marriage license fees, marriage license funding is vital to enhance statewide stability of social service agencies, providing support to victims of intimate partner violence and sexual assault. According to the Nevada Coalition to End Domestic and Sexual Violence, last year during the COVID-19 pandemic, community-based programs reported serving 21,121 first-time contacts and 11,989 repeat contacts. So that's a 6% increase in clients statewide. And they saw a 33% increase in hotline calls and a 14% increase in bed nights. Individuals typically experience multiple forms of abuse. In addition to domestic violence and sexual assault, this data found victimization included child and elder abuse and neglect, child pornography, stalking, kidnapping, identity theft, burglary, teen dating violence, hate crimes, and human trafficking. Marriage license funding is the only state funding, as Senator Scheible said, or Liz said, I'm trying to remember, available to our programs from the state. And it is also more flexible than federal grants, and it covers necessary infrastructure. So I can personally say that part of my wages are covered by marriage license funding, because most funding does not cover the types of infrastructure in employee salaries that you need to actually run the business. We have learned from the pandemic that we have to be poised to expect the unexpected if we want our services to be sustainable. So please, please, please consider supporting SB 177. And I believe we have until April 20th to be able to speak to our senators about that bill. So I just want to wrap up by saying domestic violence and sexual assault have been referred to as quiet epidemics for a long time before COVID-19 spread across the globe. Quiet because it hides inside homes and behind closed doors. Victims go unbelieved, dismissed by the judicial system, and questioned by the media. And it takes all of our voices and actions to bring this epidemic to the forefront, support victims, and make our community safer for everybody. And I really, really, truly appreciate being invited to this panel. And I thank you all for taking the time to listen. So thank you very much.
Carolyn, were you going next?
Yes. Okay. My name is Carolyn Mascari. I was a advocate supervisor at Safe House for, I think, 18 years. I'm not quite sure anymore. And my job basically as a legal advocate was to help them understand the court system, go with them when we went to court to support them, and just try to keep them, tell them the truth, even though sometimes they didn't like it because it wasn't what they wanted to hear. But I felt like my job was to be as honest with them as possible and to get them back to where they could care for themselves. I didn't want them to transfer their dependence on the abuser to dependence on me. So I would make them, have them do as much as I would do. Like I'd say, okay, I'll call the court and find out what's going on with the trial. You get down and file for your food stamps, okay? Because when I'm not around anymore, I figured they're going to need to know what to do with themselves. Otherwise, they're going to get back in the same situation. So, and I've been gone from Safe House now for about 5 years, but I still probably got right now 4 or 5 active domestic violence cases because I can't say no. Especially I've had clients that were mine years ago that have come back needing some help. When my church found out that I was an advocate, they sent everybody to me too. And I can't say no. I can't just tell people that, oh, I'm retired, I can't help you. So I'm still doing it, but it's one of those things that I'll probably never stop doing. And it's also, as Michelle knows, I'm a CASA as well, a court-appointed special advocate. I volunteer to help abused and neglected children. So my life is pretty much still pretty busy. Just and I have not been as up to date like as what Beth was telling all of them, what I was hearing from the senator about the bills and everything. But I have to say, I'm definitely going to be in support of the ones I've heard of, because the nice thing now is that I'm not employed at Safe House. I can be more vocal out in public. We're not really allowed when you're working someplace to be too political, but now I can. So that'll be a good thing for me. I don't really know too much else what to say. Beth really covered everything, and she knows more about what's going on in the shelter and things as I do. I've worried a lot about the shelter during the pandemic because I was so afraid. I would have people that I would refer to the shelter, and I'd refer them to Safe House and to Safe Nest and to Shade Tree, and they couldn't get in anywhere because they were too full. And that was really very scary. And they, I can't put them up in a hotel or anything. So that would be a very scary thing to deal with. Some of them I heard back from and they were okay. Some of them I didn't, and I don't know. I don't know if they are or not. But I'm still willing to do trainings and do anything else I can do to help, because it is my passion. Helping people, whether they're domestic violence victims or children, is my passion. So I don't really know what else to say now. I've known Michelle for quite a while, and she was when I was working, and she's always been one of the best as far as I'm concerned. So, and Beth has also been one of the best as far as running Safe House. So I don't really have much to add. I think she covered everything.
Thank you so much, Carolyn. We appreciate you. You are amazing. And I know you're kind of retired, but so happy that you are always going to be an advocate for everyone. I always tell everybody I'm retired from making money. Although I didn't make a lot. It was a nonprofit, but still. Yes. But I'm honored that Michelle asked me to join this. I am, and I'll do whatever I can to help with any of these projects. Thank you so much. And thank you for coming on this special day today. We appreciate it.
You are welcome.
Thank you. And it's inspiring. And one of the things that people don't always know about Nevada now is we're all volunteer. A lot of the organizations in town are advocates or paid organizers, and we're all volunteers. So I completely understand when you say, Carolyn, about the unpaid. I think I work full time, but it's volunteer. So
exactly.
I completely feel it. It was very inspiring what you're doing. Thank you so much.
Thank you. Yeah, I get paid, just not in money.
Precisely. We feel good about that's I say, as long as you feel good about what you're doing. So
yes.
Thank you so much. So Michelle, do you want to? We have a Shade Tree would be next on our list. Do you want to introduce them?
Yes. Thank you so much. So I will tell you, my first experience with Shade Tree was about, again, 14, 15 years ago. And I had a mom who needed to get somewhere quickly, and she knew right where to go. She had called. They had a bed available for her. She had a 5-year-old child with her. And when she went to the program, she was very grateful. And I had never heard of Shade Tree ever. And I have driven, I drove down Washington for a long time and didn't realize. And so when she came out of the program, she began volunteering. She was able to speak about what the program did for her and her child. And I was so grateful that they could stay together. She left every day to try to look for a job. She had someone that could watch her son. So it wasn't just let me stay here. It was let me stay here. Let me find resources. They will help me get on my feet. And so that we were very grateful for. So I appreciate Miss Linda and Jasmine coming to talk to us today about Shade Tree. And the floor is yours. I'm not sure who wants to go first.
Hi, thank you. Thank you all for having us again, Jerry. All of everyone here just does amazing work. So I'm grateful to be part of the Vegas community. It's only been 2 years now, so I always have to say that I'm still a newbie kind of, but everyone has been so wonderful. My name is Linda Perez. I am the CEO of the Shade Tree, and everything pretty much what Elizabeth, I'm going to reiterate what Liz said earlier. It kind of everything the same that she said of having to just adjust the way that we do things when the pandemic happened. But the Shade Tree has been around since 1989. And when I look at the history of, how long we've been in existence, and we get to celebrate with my team, right? Because it's been, 31 years now. That if we weren't here, or if Safe House wasn't here, or Safe Nest wasn't here, we've touched so many lives that all of those people, what would have happened to them, right? So all of our organizations just do amazing work, and I'm grateful for that and to be a part of it. I'm also a survivor. So when the pandemic first happened, we were all fearful, right? We didn't know what to do. We've never experienced anything like that. And the biggest hurt for us, and when I say hurt, it hurt our hearts, that we had to adjust. And the one thing that we were worried about the most was having to decrease capacity. So we had to be creative on how are we going to continue to do what we do? How are we going to continue to touch lives and with what's going on, right? And we were very creative. Like Elizabeth said, we created an isolation area to, in case anyone became ill, for the staff that was not client facing, we were able to do remote working, and case managers and client advocates if they were meeting with their clients, then it was Zoom, things like that, or not in office spaces anymore, in open areas. So all of those things that you all did, we had to do that as well. Cleaning, when COVID money became available, that was helpful, right? Because we were able to now plexiglass pretty much everything. We had to remove some beds from one of the dorms so that we could allow more distancing, but we really had to try to be creative in what we did. We also started non-residential programming for those clients that maybe they didn't need a bed, but they needed case management, and they needed to work with our life skills groups or whatever it was. That was one of the things we did. We also launched in October, Domestic Violence Awareness Month, we launched our crisis hotline during that time. So we really did try to think about how can we continue to work with our partners and continue to do what we do. And I don't want to keep reiterating everything Elizabeth said, but I think we've all been in the same boat to try to adjust the way that we do things, right? We have seen a shift in our clients, so they are more domestic violence now rather than homeless. We've seen an increase in that. We also did have to change our meal times. I was taking notes when Elizabeth was talking, so I didn't have to keep reiterating everything, but so we did all of those things, and I'm happy to say that, and I'm going to let Jasmine tell you more about the statistics from our crisis hotline since we launched it, and a little bit more about the programming that we're doing now, because we've also changed that a little bit as well. But I am grateful also to the community, because they did not forget about us. Just like Elizabeth said, they really reached out because we didn't know what was going to happen. We didn't know about funding. And the community has been so great. You all have been great with the mask, with cleaning products, with just clothing, just calling and saying, hey, do you guys need this? Or, hey, can you use this? We have so much, all of those things. The community really did not forget about us, and we are grateful for that. We couldn't have our gala, which is our largest fundraiser, so the thought of like losing that revenue coming in, right, for our clients was scary, but we made it through. And what I can say is I'm grateful for all of our partners because you all were there and helpful and supportive. I'm grateful to the community and just everybody. I can't thank all of you guys enough for everything that, you know, you all didn't forget about us, and you all were there to continue to support us in whatever way that you could. And as I said, the pandemic was hard, but we had some wins that came out of it. It allowed us to pause and look at our programming, look at our organization, and we've made some really great changes. And for those that were on when we first got on at around 9:30ish, I welcome you guys to come and set up a tour. Please, we love to show people what we've done internally, our programming. We just hired our first director of clinical operations, so we are adding a mental health piece to that. So when we talk about domestic violence or human trafficking or homeless, it's not just one thing, right? Not just one trauma. It's multiple layers of different things. And mental health is one of those issues, a huge issue. So now we have the medical side of the clinic, but now we'll also have the mental health side. So we will be hiring a therapist. We're going to start off with one and possibly two. Well, that's the goal. So when I say that during this time has been hard, we've had some good wins out of it too. So feel free to reach out, schedule some time with us. I'd love you to meet my new leadership team, who have been just amazing. We would love to share what we're doing. And yeah, that's I don't know what else to say, because Elizabeth was like perfect of everything. Yes, you are. But I'm going to turn it over to Jasmine, and she can tell you a little bit about the hotline and the new things that we're doing in programming with Metro and PFI, and just amazing things. So your turn, Jazz.
So I don't know how anybody wants me to follow any of you guys, but okay. So no. So good morning. First, I just want to start by saying that I am very happy that we are all safe and we have made it this far. So let's just start by saying that we made it. As Linda was saying, the pandemic to a certain extent was good to us because we were able to really look at the program and look and see where what areas needed to be improved. So just to speak a little bit on the hotline did launch in October for Domestic Violence Awareness Month. From October to today's date, we have received a little over 1,000 phone calls to come through to our hotline. Our hotline is usually managed by our case managers, as well as we have volunteers who will answer the phones. We actually just recently have decided to add an addition to the crisis hotline. So we will have what we call a crisis response team. Those individuals will be partnered with Metro and PFI, which is a private security company. Is that what it is, Linda? It's a private security company. They will be able to call into a telephone number, which will allow us to go out to provide hygiene packages, safety planning, referrals to shelter. We can also complete the intake on the scene and bring the client into shelter. The reason it was very important for us to start the crisis hotline, not only because of course, Domestic Violence Awareness Month, but because of the pandemic, what we noticed is people were scared to come out of their house, or they didn't feel that it was conducive to come to the shelter to do an intake, to not know if they were going to have a space or a room. So the crisis hotline allows us to go through certain protocols on the phone to approve them for shelter. If they're approved for shelter, then we're able to hold the bed for 24 hours to give them time to come down to the shelter. Within the shelter, piggybacking off of what Linda said, some of what we did as well is we now have So for those of who don't know or have not been to the Shade Tree, it's 3 floors. So our 3rd floor is actually our ISO area. So we're allowed to, what we have done is we're able to bring clients in a shelter, and we're able to put them into an isolated area for 5 days, so that we're able to monitor if there's any signs of COVID or anything like that. We have the health department who is able to come out to do COVID testing. We're able to do sign individuals up for vaccines if that's what they want to do. We have what we call a high lethality dorm. So what we've noticed is we're starting to receive an increase in domestic violence clients. And we have individuals who have severe or who are extreme high lethality who may not feel comfortable being in a dorm setting because the first 24 hours are the most sensitive for that individual. So we've actually put together a really beautiful dorm that's more of a home setting. It's a small amount of individuals that can go in there. We do have the non-residential, like Linda said, so we have 3 apartment units that we can house individuals in for a certain amount of time of their programming. If, again, being in the shelter is not conducive for them, or maybe they're high risk with COVID, or they're elderly and being in the dorm may be sensitive for them, so we can put them into these units that we have off property. We have so much, I can't even begin to run down the list of all the things that we have, but like Linda said, I invite everybody to come down to do a tour, because just 10 minutes wouldn't even give us enough time to be able to discuss all of the amazing things that we've done. You know, it's an honor because now we are able to assist our partners quicker. We are able to assist them, you know, in a timely manner, so our partners can call into the hotline. We're able to take their clients from that, take their clients to the hotline as well. Oh, one more, and then we have our HT dorm, so that's our human trafficking dorm. So for any clients who are experiencing any type of trafficking, or they're coming through from the rape crisis center, or they're sexually assaulted, we have a dorm specialized just for them as well. So again, come down so we can give everybody the details and do a tour and walk you guys through the building so that you can see all the things that we have to offer. And I think that's all I have, Linda. Did I miss anything?
No, that was a great job. Like I said, there's so many great things that all of us are doing, right? I do want to mention Jasmine, my director of programs and education. She is also on the hotline. So she takes shifts herself. So sometimes she's on that crisis hotline at 1, 2, 3 o'clock in the morning. So I just want to give a shout out to her, and really again to all of you for inviting us, and for all of you doing the amazing work that you do, and also supporting the work that we do. So yes, that's us at the Shade Tree, and we're just grateful. So
thank you, Linda. And I did take the tour. You had just started back, obviously, before the pandemic, and I took the tour. We'll have to, once we get all of our board, I had my 2nd vaccine, and I've got 1 more week, and I'm sort of going to open up a little bit, but it'd be great to have our board come down and see it. It was an impressive tour that we took.
Yeah, well, Jerry, if you were impressed then, you're going to be even more impressed now. So I can tell you, we're just really excited about the things that we've been doing. And the good thing about the pandemic was it allowed us to pause and just look at everything. So thank you all.
Well, we would love that. Thank you. And what I didn't mention before is if you have any links from any of the organizations, or, you know, links for donations, or you know, if you want to put anything in the chat, we save it, and then we'll put out something to let activists know how they can, you know, view the program, and then how they can help. So then Michelle, you want to introduce our next speaker?
Absolutely. Okay, so Safe Nest is probably the only other number that I had memorized from day one, 877-0133. And I know that because I would have to call regularly, you know, to get updates about our parents who are going through classes. And I will tell you, the responses that we get from the therapists at Safe Nest and the people who teach the classes are remarkable. And they really talk to us about what our moms or what our parents have learned in classes, and they're really available all the time. I don't think I've ever had to call twice for an update. When we go to court, we have to be able to present, what happened before, what it's like now, and what our parents are going to do differently. And a lot of times people go back. We know that it takes a long time for people to leave their abusers. But I will tell you that because of Safe Nest, I feel like we've had a lot of successful stories with our women and their children. And a lot of times when our parents are going to Safe Nest, they are separated from their children, as opposed to the other two places where they are with their children. A lot of times we have families that are separated. So just to know that that is an avenue which we can get children and families strengthened and back together is, I have chills right now, Liz. I need you to know I have chills. So we are so appreciative of you, and we love Safe Nest, and your staff is beyond wonderful. So welcome, thank you, and everybody is wonderful. So you're up. Thank you.
Thanks for that introduction. I think we had 79 reunifications for moms who'd lost their kids to CPS last year, right, during the pandemic. It's normally a bit higher, but everything struggled a little bit. So I know at the top, I think Eva asked us for good news, right? So I'm gonna preface mine by saying I have good news, is that all of what we do is preventable. And I'm gonna talk about how we get there. But I'm going to first give you an update on Safe Nest and what we do that's different, right? When you think domestic violence, we fit the same stereotype. We offer shelter, hotline, all that stuff. I'm going to tell you about what we offer that's different from what the other folks have chatted about. So first of all, we serve about 25,000 clients annually, and we have 90 staff. We're quite large. We're one of the larger domestic violence agencies in the country. And we are involved in the entire continuum of domestic violence and its intersectionality with sexual assault and sex trafficking. It's about a 40% overlap in the clients that we serve that are also struggling with those issues as well. So we work in a pretty consolidated way. We work in prevention, protection, and empowerment. So I'm going to talk about prevention, right? And this is where my good news is. So here's what we know. 76% of kids growing up in domestic violence households are going to repeat the cycle as victim or as batterer. That was a 3-generational year study that was done, right? Followed domestic violence families, got the data, it's peer reviewed. That's not hyperbole, it's the number, 76%. So if we do the backwards math for Clark County, we have 100,000 kids a year that are growing up in domestic violence households. So when people ask you why domestic violence is so bad here, it has nothing to do with the half nudie billboards or our Sin City lifestyle. It has everything to do with what is happening in the walls of a home. And that is where domestic violence can be prevented. So I'm gonna talk about that, and I'm gonna talk about the kids that we work with in prevention. So some of you may have seen our recent press release. We got a $500,000 gift from Intermountain Healthcare to launch Coaching Boys into Men and Athletes as Leaders. This is a school program designed to elevate coaches' understanding of the arenas of healthy relationships, consent, and sexual assault, and have meaningful conversations on purpose with their players, and at the same time, intervene when inappropriate conversations are happening. I have an 11-year-old little boy, and when he says locker room talk, I want it to be about the towels are a mess on the floor. This idea that locker room talk is in any way acceptable is something that drives the ability for perpetrators to live and feel empowered in their own households and beyond to do the things that they are doing. It's a lifestyle that we allow young men to grow up in. In the same way, in the female program, we have got to work on women tearing down women. You see this a lot. I was an athlete in both high school and college, and I can tell you I have both perpetrated it and been a victim of it, women tearing down women. We have to learn how to strengthen each other. We also have to learn how to be bystanders for each other, active bystanders, and support each other. And the Athletes as Leaders program, along with talking about consent and appropriate conversations, has got some specific modules for girls growing up to become strong leaders. What we know is that 95% of all CEOs in Fortune 500 companies were athletes. So this is how you drop a penny in the pond and get a tidal wave on the shore, right? That is what we're working for. We also have a program specifically targeted at kids that are in domestic violence homes, right? So not only Safe Nest kiddos that have come through our program, but also working with Christina at St. Jude's Ranch. We work with Child Protective Services. We work with Boys and Girls Club, Immigrant Home Foundation, the list goes on. We take 90 kids away for a week to summer camp. We take them away. We take them up to Park City, Utah, to a YMCA camp that's just about half an hour east of Park City. There are horses, mountain bikes, a river, cabins, everything that you would picture from, like, if you were to picture the perfect summer camp, this is probably what would pop into your mind. We do one camp for older kids and one camp for younger kids. The camp is designed to give kids their childhood back, but it's also designed to do something very specific, which is build their HOPE score. So we use the scientific metric of HOPE, which you can Google if you'd like. And so, sorry, did I cut out for a minute? Yeah, that happened, sorry. So I hope you can Google and get information from University of Oklahoma, but we measure this. HOPE is a better indicator of a child's ability to break the generational cycle of violence, opioid addiction, obesity, smoking, sexual assault, both perpetrator and victim of domestic violence, and the list goes on if we can build their HOPE score. So we measure that not only in the children that we work with, but also in the victims and the perpetrators that we work with. So that, when we talk about prevention, it is scientifically evidence-based driven prevention. That is where I would like 90% of Safe Nest's work to be, right? Unfortunately, that's not the case. There is no federal funding around prevention. Marriage license, as we speak about the power of SB 177, is the primary funder, along with all the private donations that we work to get, primary funding for prevention. In fact, I cannot take a VAWA dollar and use a penny of it on prevention. I cannot take a VOCA dollar, Victims of Crime Act money, which is the largest funding source for agencies like mine, government funding source, and spend an ounce of money on either a perpetrator or prevention. So there's such a short-sightedness to the way that our government has structured the funding. And unfortunately, domestic violence agencies have been on the forefront of fighting for that funding to continue in the way that it's structured. So there's time, it's time for a shakeup, not only at the state level, which is minor, but at the federal level on how these funds are being used. What I tell people a lot of the time is, if I was a cancer surgeon and I'm instructed to operate the same way domestic violence funding is operating, all I can do is say, oh my gosh, I really hope that tumor doesn't kill you. Let me make you as comfortable as possible, and I hope you don't die. I can't remove the tumor, and even more importantly, I can't figure out why the tumor got there to begin with, right? Domestic violence victims are essentially incredibly important, and their victimization needs to be handled with care and trauma informed, but their victimization is a symptom of a perpetrator's abuse, and we fail to deal with that. What we say as a society is, okay, incarcerate, give them fines, but what we're not understanding is when we incarcerate and give fines, we're making the victim suffer, because it's a unit, whether we like it or not, and especially if there's a child. In fact, 57% of women say they are homeless because of domestic violence. Domestic violence caused their homelessness. Okay, so it's time for us to stop as a movement focusing simply on the victimization side and start to understand the entire continuum. Because until we do that, we can't develop a justice system that makes sense for domestic violence. We can't develop remedies to make sense for domestic violence, and the list goes on. And the reason Safe Nest knows this so intimately is because we work with perpetrators. We are in the court system. We have 11 locations throughout Clark County. We're in Mesquite. We have an office there. We see the breakdown of this at almost every juncture. So that is how we're a bit different than other agencies. We're in that entire space prevent, protect, and empower. Other than that, we operate much in the same way as Safe House, in that we have a confidential shelter and we have advocates that support clients navigating their space. And we measure hope to see whether or not what we're doing is actually having an impact, because that's the biggest indicator. To speak just a tad about the pandemic, I will just be very honest with you and say we didn't do a whole heck of a lot to shift. We expanded and we grew. I joke with my staff that we sort of put masks on and ran into the fire. We did not limit capacity in any way. In fact, we expanded capacity by at one point when we were flexing because so many people needed beds, we went up 150% in capacity. Now, I didn't do that completely blind. I was in constant communication with Deacon Tom and others who run large-scale homeless operations. In fact, if you look at the Clark County data, only 42 cases of COVID were spread in shelters. So it started to become really apparent to me very early on that this spread inside shelters was not, for some reason, not happening. Now, we can argue it's because people put up plexiglass and walls and all those kinds of things. Sure, that's all fine. Our biggest thing was we're not limiting capacity and we're not changing the way that we operate because we can't. Instead of in isolation rooms, we, for a period of time, we brought in an RV if it was necessary. It wasn't ever necessary. We never needed isolation. And I don't deal with an insignificant number of clients, but we did use hotels and apartments that we rent effectively to flex that. So we just kind of kept pushing and sort of waited. We had 11 cases of COVID on staff. There was no staff to staff or staff to client or client to staff transmission. So we monitored and we were ready to adapt if we needed to. But fortunately, we never saw it blow up in the way that everybody was nervous about. And now we're tracking some of the research that's coming out of third world countries where they're not seeing the spread. And we're trying to figure out, there's a reason why it didn't spread within the shelter and homeless population the way everybody expected. And getting to some of that will be very interesting in understanding that. So, the couple things we did see through COVID, of course, as I've spoken about and everyone else has, numbers just flew up. We run a Metro response program where we are out on every domestic violence phone call that is an arrest or probable cause for an arrest. We also do all the emergency temporary protection orders for the county. So we're in the right space at the right time. We went 24/7 with that program in September. And that's an example of we just didn't stop. I mean, everybody kept saying, the Metro kept asking, are you guys going to stop coming on calls because of COVID? And we said, no, we'll just mask up, figure it out. And I'm happy that we did. And that also grew our numbers quite significantly. And we saw more male clients, so we used some of our alternative housing options for that. Quite a few more male clients, and a lot of male clients with kids. So we got pretty sensitive to that and understanding how to do that. We also engaged in 2 large-scale research studies, and those will be published probably in the next 6 months. One for batterers treatment. So many of you may be aware, we are the only nonprofit provider of batterers treatment. We're the only provider of batterers treatment that also works with victims in the state of Nevada. So we have this incredibly unique perspective. So we are partnering with UNR for a large-scale study on the effectiveness of batterers treatment throughout our state. I will tell you, we are the only provider that actually tracks outcomes for batterers, which I think is pretty scary when we think about the levels of violence in our state. The other research study that we are in part of with Lee Goodmark, who's an author we brought in right before the pandemic hit to speak at UNLV. Her book is Decriminalizing Domestic Violence. And her basic hypothesis and thesis is that the justice system is not a place for domestic violence victims to find justice. Our experience is, we have advocates at the DA's office, in family court, and we work quite regularly with the municipal criminal courts. And I think she's got a pretty good point based on what I see, right? The DA's office wrote off 75% of its domestic violence misdemeanor cases last year. City of Las Vegas wrote off 58%, which means there was an arrest, which means there was physical violence on the scene, and they dropped the case. So and they may have dropped it because the victim didn't want to move forward. That's highly possible. But what we're not seeing is a justice system that's equipped to deal with the complexities of relationship violence. So that will be very interesting out of UNLV study on what victims want for justice. And we're hoping to introduce in 2023 a sweeping criminal court system change for how domestic violence is prosecuted in our courts that allows for restorative justice, appropriate restorative justice, well before our county spends almost $200 million a year on domestic violence. It is the #1 court case in our system, and it's clogging it, and it's not the right solution for the victim of the crime. So let's figure out how to do this more effectively. So we are highly visible with a lobby firm and everything up in Carson City, and as we need in Washington, D.C. So again, when I say we're in the entire continuum, you know, our mission is to end the epidemic of domestic violence, and we take that really seriously. And that's what you see in our work. So we are busy. I don't think anybody stopped being busy during the pandemic, but I will tell you that the PPP loans that came down, as well as all of the other money, and that now there's the additional pot of money, right? So we are certainly lobbying for how that is spent, because our county was not functioning well with domestic violence before the COVID. It wasn't like we were overly resourced, and I think anywhere, but domestic violence and sexual assault for sure. So we're involved in trying to craft how that money is spent as well. So that's how we're a bit different than the other two agencies on the phone. But we all work closely together. I know we refer folks to Safe House, and likewise receive clients from Safe House, and are happy that Shade Tree is available for clients that are coming to us but may not necessarily meet the lethality indicators for us to be able to provide a bed. And that's the thing I'll end on is we use lethality assessment as to whether or not you get a bed in shelter. And let me just tell you how backwards that is. It costs me, I think the last study that we looked at, it costs us anywhere from $25,000 to $50,000 to truly help a victim navigate their domestic violence. And that's on the low end. And that includes going through shelter and transitional housing. It costs me $1,500 to house a client who is earlier in their domestic violence experience, help them with a few weeks in shelter, getting employed, getting up on his or her feet, and then moving into an independent lifestyle. But the way we are resourced as an agency, because we have not enough beds, we're not able to take people with a low level of lethality because they're not imminent for homicide. This is a huge, it's just frustrating for me as someone who's in this leadership space, which is why we are working to greatly expand the footprint of what we're able to do inside the shelter environment with advocacy and things like that. But there are a lot of hypocrisies within our movement, which I think it's a great opportunity for sort of a fresh approach to some of these sort of like things that we've held dear as a domestic violence movement. I think it's time to shake some of those up and move some of that. And I think some of that's gonna happen in the next couple of years, because it's time, right? It's time that we listen to what victims want, which for my focus groups, that's 73% of the time, that's reunification with the batterer. Do we offer a pathway for that? We do, but that's rare. That is rare. But if that's what victims are asking for, how can we figure out whether or not that's safe for them? And are they asking for that because that's the only financial resource they have? Or are they truly asking for that because that is what they want? So there's a lot of complexities in the domestic violence world. But yeah, that's just a touch of what we do. Sorry, I could talk for hours, but I will end there. So thank you.
Oh, thank you. And one of the things that is hitting me as I'm listening to the different things that the different groups provide is that, Nevada now we've grown in size of our volunteers, and we really would need to stay in touch with you and find ways that we can help, not just have a program. I was really impressed with when you were talking about the Coaching Boys into Men program. If that's something that you could send us more about, that we can help promote, I'd really like to hear more about that and find out how we can help promote those prevention ideas you have and are working on.
Yeah, absolutely. We're fortunate we have the Raiders as a partner in that space. So they've got, right, my guys that I hired for that program have been on now 3 coaching clinics with John Gruden and all the players, and they're in heaven. Yeah, I will send you more information. It's an amazing program.
Yeah, it really sounds like it. And certainly, like you say, prevention is not something that is funded, but it can be promoted. And I think that's a great idea. So, Michelle, did you have anything else to add on speakers, or maybe we'll see if we have any questions?
I have nothing else to add. I mean, that you guys are amazing, and I felt excited, angry, ready to work, and ready to continue with the movement all in one, conversation. So we thank you so much for coming today and really continuing to help during the crisis and then before the crisis. And so, yeah, I agree with Jerry. Send us information so we can get moving too. Thank you.
And links to ways that people can help, for donations, or be it monetary or items that you need. Anything you can send us. If you have some things to put in the link in the chat, that's great. But if you just email us and let us know. And on a regular basis, please let us know how we can help, because we have a lot of people who come to us as activists, but activists need something to do, and so we try to provide that. So that's exciting.
Thanks. So I did want to say a shout out to Hanadi, who's on our board. And I will tell you, the biggest thing you can do right now is we need 2 Republican senators to jump sides on SB 177.
Okay.
I will send the policy brief along with we've attached the senators' numbers, but pressure works. So phone calls, emails, that this is important to support. They will continue to say, oh, but domestic violence and marriage, that shouldn't be funded together. There is no other funding stream. We cannot tax alcohol. We can't tax divorce. So this is it. So the more pressure you can put on some Republicans, the better. And I've been getting beat up and doing the rounds, doing it as well. But if you just want to send or call, they will be nice to you, I promise.
Oh, no. And that's the kind of thing that Sue and I are working on with the legislative committee and the others on the board. We meet, right? We chat on Slack throughout the hearings, and we send each other things to do. So that's definitely something that activists can do within our legislative committee, but also we can let members know, because that's, again, we want actions that people can help with. So that is definitely, we'll get right on that.
The sooner the better.
One talking point that you can add to that when you are talking with your senators too is that right before this, they did Assembly Bill 176, which created the Sexual Assault Survivors Bill of Rights. And part of that Bill of Rights is that sexual assault survivors have an advocate to speak with. And they did a research study which showed that they would need 2,000 more advocates in the state of Nevada to even meet that Bill of Rights. So that's another very important talking point for that, for SB 177. Just wanted to add that. Thank you.
Beth, is that something maybe you could send us a little email about so we can add that to our action?
Yeah.
When we send out an email to our members, we usually include those type of things. We put it on our social media, and then, within our committee, we encourage people to take these actions. So if you could just maybe even send me just a little couple sentences about that we could add to it.
Absolutely. I can definitely do that tomorrow.
That would help. Okay. Thank you so much. Do we have any other questions? Anybody have? I wasn't watching the chat that close. Eva, did you see anything we haven't covered?
I don't see any questions. I see a lot of comments and links, and who to call. Jasmine, thank you for putting the hotline in there. That's good. Great.
Robin, did you have a question?
No, I just had a comment because they answered my questions. They gave me all of the contact information, because I definitely want to look into. I've actually volunteered at Shade Tree. I've worked with Safe House and Safeness throughout my time with the department, and I can just say that I truly love what you guys do. I'm extremely passionate about what you guys do, and I truly appreciate it. I actually I was the supervisor for the DV unit that we created with the department to work with on the CPS level. So on our NIA level, I am working with them. Well, I was working with them. I was that supervisor to help actually develop that and create that so that we could work better with safeness. And I just truly appreciate the effort. And I do know I'm actually part of a women's group that we focus on domestic violence. It's the Women's United. So we put on different conferences to bring about, domestic violence awareness. And so I truly believe that this is a cause that is unheard, that we do have tons of women who feel that they are alone and that they can't tell anybody. So to have you guys as those people to support them is just the best thing that they could ever have. I actually went through a domestic violence training this past week, and I realized that a lot of the stuff I say is not right. So it's always learning and it's always growing. And I just appreciate everything that you do. Miss Carolyn, she and I, we work together all the time. I used to refer my clients to her all the time. So I know her. You guys just are awesome. So thank you.
Thanks, Robin. Robin's a new member of NOW and been helping us on our legislative committee as well. We appreciate your help, Robin. Thank you. So I didn't know if we saw any other questions or maybe you see anything we need to bring up. Thanks, Sue, for putting the legislative committee information in there.
Hanani, did you say anything?
Yes. Hanani?
Yeah. I want to say that thank you so much, Michelle, for making me a part of it. I mean, I love to hear what, I mean, there was a lot of information, and definitely I would love to support. And as I am, Lynn said, I'm the board member of Safe Nest, which I'm so happy and proud of. They are doing wonderful, wonderful work, and would definitely love to support you guys, because this is a cause I'm very passionate about, and this is very important for all of us to support it. Thank you so much, Michelle, for making me part of it.
Thank you. Hanani is our merge sister as well. Thank you so much.
Wonderful.
Yes.
Well, thank you so much. Thanks for joining. We'll have a lot of these links that we'll put out to our members as well, and we'll have the program, it's recorded so that we can let people know how to help. And please stay in touch with us. Let activists know how they can help. People come to Nevada Now wanting to be involved with issues and want actions to take. So please stay in touch with us. We'll stay in touch with you on how we can help, and we'll come take those tours so we can learn more. So thank you so much, and thanks everybody for taking time on a Sunday morning. We had a special time this time, so we appreciate you joining us and hope you have a good rest of your day.